My name is Susan Fados, and I serve as the board member for the XLH Network and as chair of the Symposium Committee. I can't tell you how excited I am to be here today. Today's meeting is the result of almost 2 years of visioning and 10 months of hard planning and a lot of work by many people. As I look around this room, I am just so humbled and grateful by all these people that are here ready to participate and to help support families with hypophosphatemia. On behalf of the entire board of the XLH Network, welcome to this externally led, patient-focused drug development meeting, the Symposium on Hypophosphatemia, Past, Present, and Future. Whether you're here in person or if you're joining us through our live stream, whether you're an individual affected with hypophosphatemia or a family member or a caregiver, we are grateful that you are here taking the time to come together as a community to voice your experience and perspectives. You are the experts, and it is through your testimony, your poll answers, your survey results, and your comments today that we teach those that need to know that chronic hypophosphatemia is, in fact, a whole life, whole body disorder. Our hope is that after this meeting, patients, clinicians, industry members, academic researchers, and other stakeholders will have improved tools to use when treating adult patients with hypophosphatemia. We hope that we will be able to reduce the number of times a patient leaves a doctor's appointment in frustration, exhausted by the number of times they've had to argue with their doctor that their pain and their stiffness are real symptoms of their illness. We hope that through this meeting and our data reports and video deliverables, that patients will feel increased empowerment when advocating for themselves in the medical arena. Our belief is that the impact of hypophosphatemia on adults has been poorly recognized and undertreated, and that the treatment endpoints that matter most need to be identified. That more people need to recognize that while once thought of as a childhood disorder that magically disappeared when the growth plates closed, hypophosphatemia does have long-term adverse health consequences. It can manifest in a variety of potentially disabling ways later in life, most notably in spontaneous dental abscesses, hearing loss, chronic pain and fatigue, poor muscle function, osteoarthritis, and other factors that reduce mobility and range of motion. We want others to understand that chronic hypophosphatemia is a multi-system disorder, affecting not just bones and teeth, but also muscle function and energy levels, and that all of these symptoms can understandably affect emotional and mental health as well. We think our impetus is best summed up by this quote we received from a patient during our pre-event, who responded to our pre-event survey. When I was a child, I thought that the worst thing about having XLH was that I was different, and that I couldn't always do the things my friends did in sports and stuff, and that I was short, and that people made fun of me. I also thought, or I was told, that it would all go away when I became an adult. Little did I know that this disease would knock me down far worse in adulthood than any mean comment on the playground ever would. We recognize that our community is at a turning point with increased treatment options. This past year has been one of change and hope for us, and we're very grateful for this. We also know that there's more to be done. The burden of this disease has shifted, and now the focus must be on helping those that aren't eligible for the current treatments find a treatment that works for them, and on finding improved ways to treat the impact of living for years with inadequate phosphorus levels, and on ultimately finding a cure. The work cannot stop now. The work cannot stop now. There are so many people to thank for this opportunity to make our voice heard today. Meghana Chalasini and Pujita Vaida from the Office of Strategic Programs Center for Drug Development, Drug Evaluation, and Research at the U.S. Food and Drug Administration have been invaluable in helping us navigate this process, and their encouragement and support along the way have been appreciated. We are pleased to have Dr. Teresa Kehoe in the audience with us today. Dr. Kehoe is a clinical team leader in the Division of Bone, Reproductive, and Urologic Projects within FDA's Center for Drug Evaluation and Research. We thank you and your colleagues in the room and online for being with us today. We wouldn't be here today also without the support of our sponsors, including Ultragenics, Inozyme, Ionis, and the Everyday Life Foundation. We thank you for your support as well. I am here today not only as the chair of the planning committee, but as a person with hypophosphatemia who was told at age 19 that I no longer needed to be treated for my XLH, who was told the same thing repeatedly over the years whenever I sought help for what I knew were XLH-related challenges, who didn't meet a doctor with any real experience in XLH until I was 54 years old. I am here because while I know we can't change the past, and we can't reverse the joint damage and the hearing loss and the other issues that might already be in existence for adults, we can change the landscape ahead for others. I'm also here because in 1962, after being told by the medical team at a renowned university hospital that they were befuddled by my condition, my mother wrote to famed scientist Linus Pauling to inquire about a theory she had about the cause of my low phosphorus levels. I can only imagine how scared and alone she must have felt to do so. And it is my hope that forums like this one today help to reduce the chances that of anyone else having to feel such uncertainty about their loved one's health. Linus Pauling did write back, and her theory was incorrect, but she's still my hero for trying. And speaking of heroes, I want to thank our panelists who were brave enough to volunteer to be here today. We know it's not always easy to open up and share your story, but that's exactly what we needed you to do. Lift the curtain and let others see the truth about the impact of hypophosphatemia in adults. Your courage, your commitment, and your hard work as we prepared for this day has been absolutely inspiring to watch. We encourage all of you here with us today, in the room and online, to follow their example and speak your truth today as well.